Hello everyone, Om Swastiastu, Assalamualaikum warahmatullahi wabarakatuh. So we are from small group lesson B5. We will present our student project entitled Acute Rheumatic Fever. Next. So this is our member group and the presentation will be continued by my friend. Enjoy the presentation.
Okay, my name is Niputanita Arisanidewi, and my ID number is 2002-511138. And I would like to explain about the background. Okay, microorganisms can be found everywhere, and some cause disease. One of it is acute rheumatic fever. Acute rheumatic fever is an inflammatory disease caused by Streptococcus infection that is common in children but may occur at any age and have no gold standard for diagnosis, and the treatment focus on inflammation and antibiotics. The ability of clinicians to diagnose and treat patients is very important to reduce acute rheumatic fever transmission. Okay, that's all about the background. Thank you.
Hello, my name is Bagus Agus Putra Arenugraha with student number of 20025112119. So the proper formulation for this student project is: what is the definition of acute rheumatic fever? What is the pathophysiology of acute rheumatic fever? What is the etiology of acute rheumatic fever? How is the epidemiology of acute rheumatic fever? How to diagnose acute rheumatic fever? How to treat patient with acute rheumatic fever? And how to prevent acute rheumatic fever? And for the objective is to know about the definition of acute rheumatic fever, to know about the pathophysiology, the etiology, the epidemiology, how to diagnose, how to treat patient, and how to prevent acute rheumatic fever. And for the benefits of this student project is that for each of us as a medical student are enormous, including the knowledge about acute rheumatic fever, including the definition, etiology, epidemiology, and its relation to the medical studies such as its pathophysiology, diagnosis, therapy, and prevention. The benefit of scientific learning is that we can learn more about acute rheumatic fever, which will give us broad insight that are useful not only in theory but in future medical practice. The benefits for society include the improvement of knowledge in a community that better understand acute rheumatic fever and the proper therapy for it.
My name is Niputulan Siwa Yudiantara with my student ID number is 2002511173. In this section, I will explain about the definition of acute rheumatic fever. Acute rheumatic fever is a disease caused by infection with group A beta hemolytic Streptococcus bacteria and attacks the systemic system. Acute rheumatic fever is an autoimmune disease which occurs due to a slow immunological response after an infection with group A beta hemolytic streptococci. Acute rheumatic fever is also an acute diffuse and non-supportive inflammation that selectively attacks the heart, joints, brain, and skin. Acute rheumatic fever is a disease that closely associated with rheumatic heart disease. This is due to the autoimmune response that causes acute rheumatic fever, which will cause defects in the heart valves and will lead to complication of rheumatic heart disease. So the next section will be continued by my friend. Thank you.
Hello, my name is Imadu Sutrananta and my student identification number is 20025111071, and I would like to talk about the pathophysiology of acute rheumatic fever. In general, acute rheumatic fever stems from autoimmune response in genetically predisposed individuals with group A streptococci pharyngeal infection. This infection involves the streptococcal antigens which mediate the humoral and cell-mediated immune mechanism, which in turn produce antibodies. These antibodies then could cross-react with human proteins. When antibody bind with human protein, it causes immune-mediated inflammation. This phenomenon is called molecular mimicry and can explain the cell-mediated immune inflammation in acute rheumatic fever clinical manifestations. Another proposed pathway is that the binding process of streptococcal M protein with basement membrane collagen type 4 epitopes induce autoimmunity to collagen and thus give rise to various manifestations of acute rheumatic fever such as the lesions of the valve of the heart.
Hello, my name is William Alexander Hartanto. With my student ID number is 200251102. 011, and I'm going to explain about the etiology of acute rheumatic fever. Acute rheumatic fever, or usually called ARF for shortening, can develop after bacterial infection that cause a throat infection from group A Streptococcus. This type of bacteria group is very well known to be the cause of strep throat, resulting from the throat infection itself, and in some less frequent situations also causing scarlet fever. However, skin and other parts of the body infection caused by group A Streptococcus rarely provoke rheumatic fever. The mechanism of relation between rheumatic fever and streptococcus has no set boundary. However, the immune system seems to be tricked by the bacteria. The immune system can be tricked by the bacteria as several tissue in certain part of the body has close related protein to the one that the streptococcus bacteria has. Therefore, instead of doing the common functions of body immune system of defending bodies from infection that is caused by bacteria, the immune system damages its own tissue, especially in some tissue regions of the body.
Okay, so first let me introduce myself. My name is Ida Winstebranyani with 3 digit ID number 044. So we'll move on into epidemiology of acute rheumatic fever. The percentage of ARF is mostly found in population that have low research due to lack of infrastructure for the surveillance of the disease and the lack of case of ARF for the clinical care, whether it is because patient behavior, which is patient with ARF who choose not to seek healthcare, or inadequate diagnosis of ARF by health staff. As for other reasons, such as diagnostic error, lack of access to the diagnosis facilities, or due to the number of milder cases of acute rheumatic fever. Based on data in 2005, as many as 471,000 cases of ARF occur every year, mostly experienced by children up to teenager aged 5 to 15 years. Updating diagnostic tool and new measure is essential to take an effort to support getting the right case number so that the number of cases in each country in a year can be suppressed.
Okay, now I will continue the presentation. Greetings to our evaluator. Introduce, my name is Dave Christopher Manhutu with 3 last digit of student number 107. Now I will explain about the diagnosis based on Jones criteria. There are two criteria. The first one is major criteria and second one is minor criteria. In major criteria, in low risk population, we consider in clinical and or subclinical carditis, and in medium and high risk population, we also consider the clinical and or subclinical carditis and arthritis, also monoarthritis or polyarthritis, possibly also with polyarthralgia. And in minor criteria, in low risk population, the parameters of inflammation and the level of fever were defined precisely. And in medium and high risk population, we consider the monoarthralgia, also with defined parameters of inflammation and the level of fever. That's all from diagnosis of Jones criteria. That will continue by my friend. Thank you.
Hello, my name is Amanda Raisa Surenanda with the student number of 2002511237. So I'm going to continue my friend's previous presentation. Besides the diagnosis by Jones, there are diagnoses by AHA or American Heart Association that is developed in 2012. One of it is echocardiographic or Doppler. Uh, this diagnosis is divided by two, which is in mitral and aortic. In mitral regurgitation, there are four criteria that all must be met. First, there are visible at least in two projections. The regurgitation can length is more than equal to 3 centimeters at least in one projection, and the peak velocity is more than 3 meters per second, and it is pansystolic. And the second one, pathologic aortic regurgitation, there are also four criteria that all must be met. First, it is visible in at least two projections. The regurgitation jet length is more than equal to 1 centimeter, at least in one projection. The peak velocity is more than 3 meters per second and is diastolic.
Hello, my name is Rizky Purba and my student ID number is 200251115X. I would like to explain about the acute rheumatic fever management. So the first one is to confirm the diagnosis. This requires a high index of suspicion, especially in patients presenting with acute arthritis in areas where acute rheumatic fever is endemic. And the second one is hospitalization and additional testing. All patients with suspected acute rheumatic fever should be hospitalized, mostly for an echocardiography and other required investigation. Additional tests such as joint ultrasound, joint aspiration, tests for other cause of arthritis, and tests for other cause of chorea are regulated by the clinical presentation and course. And next is anti-streptococcal treatment. Acute rheumatic fever patient should initiate treatment with antibiotic to treat group A Streptococcus pharyngitis, regardless of the presence or absence of pharyngitis at the time of diagnosis, to eliminate any residual transmission of group A Streptococcus. A single dose of intramuscular BPG or a full 10 days of oral penicillin or amoxicillin should be prescribed to eliminate group A Streptococcus. And the last one is treatment of clinical symptoms such as arthritis, carditis, and chorea.
Hello, let me introduce myself. My name is Juvin Livianto with last student ID number is 091. I will explain about the prevention of acute rheumatic fever. So the main prevention of acute rheumatic fever is preventing the transmission, infection, and the spread of the group A Streptococcus, as well as reduction of the comorbidity. The early diagnosis is preferred. The clinical symptom and high prevalence in the community can indicate the endemic of the infection. The clinical findings of patients with group A streptococcal pharyngitis include fever, rash, tonsillopharyngeal exudates, vomiting, abdominal pain, headaches, and sudden onset of sore throat. Rapid antigen or culture is needed to confirm whether the cause is group A streptococcus or not. The early treatment of group A streptococcus can also prevent the acute rheumatic fever. Studies show that the use of penicillin or benzyl penicillin in throat infection of group A streptococcus to reduce the risk of acute rheumatic fever is effective. But there is no evidence in the effectiveness of antibiotic use for skin infection of group A streptococcus to reduce the risk of acute rheumatic fever. Next.
Hello, my name is Ikada Sadamibawa, and my student ID number is 20025110032. I would like to explain the conclusion about this paper. Acute rheumatic fever is an inflammatory disease caused by Streptococcus bacteria that have symptoms are fever, aches, joint pain, and can lead to various organ problems. There are various theories in acute rheumatic fever pathophysiology. Acute rheumatic fever can develop after a bacterial infection, also factors such as gen, bacterial category, and environment can lead in higher rates of acute rheumatic fever. Acute rheumatic fever is common in children aged 5 until 15 years old. In a year, there are 470,000 new cases with 19 out 100 children have a disease. Diagnosis of acute rheumatic fever required two major criteria or one major criteria paired with two minor criteria. The main prevention is a prevent transmission, infection, also bacterial spread, and communicability. That's all from me. Thank you.
Okay, thank you, Sadam, for the summary. So this is our reference to arrange our student project. And next. Okay, that's all from us. Thank you for your attention, and we will close this presentation with thank you. Om Santi 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 Om. Waalaikumsalam warahmatullahi wabarakatuh. Bye-bye.